This is Average Joe PT, and on this episode, we're going to talk specifically about snapping hip syndrome. There's several types of snapping hip syndrome. Now, let's go ahead and get started. The reality is this: when you look on the internet and you see this stretch and that stretch, and this is how you get rid of snapping hip syndrome, it's exhausting. Now, whether you're running or whether you're doing some sort of like yoga stretching or whatever else you think, jumping, squatting, that causing inflammation to begin with, let's go ahead and take just a deep dive quickly on there's actually two types of snapping hip syndrome. Two types. There's an internal and an external snapping hip syndrome. Now, on the internal piece, we're going to zoom right in on this inside piece here. Now, when you look at the anatomy of the muscles that come down through the joint, snapping is exactly what it sounds like. There's something strumming or snapping like a guitar string over the top of the bone. Now, we have what's called the iliotibial band or IT band that comes down. And you also have what's called the TFL or tensor fasciae lata muscle, and those end tissues can get inflamed and cause the pain on internal snapping hip syndrome, as well as the psoas muscle on the internal snapping hip. So if you see how that muscle, I've talked about this in a couple episodes. I'll go ahead and leave a link up there for you if you want to see those. But there's a muscle group that sits on the inside of your hip. And there's also another muscle that kind of runs down from the top of your spine. Literally going to take a little guy here, zoom in, runs all the way down from the top of your spine and then attaches to another muscle, and then they become actually what's called your hip flexor muscle. So you have the iliopsoas muscle. So those two muscles combine to make one giant tendon that wraps underneath your hip and then comes up and around so that you can bring your hip up and down, or you can bring your knee towards your chest. That's the main focus of that muscle. Now, that can get inflamed. People always think, oh no, snapping hip. Snapping hip is not the issue. The issue is the inflammation of the tendons that happen after the fact or during the fact, and it's repetitive over time. That's why it's either some sort of yoga technique or running technique or some sort of repetitive activity that you're doing, whether it's exercise related or recreational or some sort of work type movement that you're doing that's repetitive so much that it's inflaming that area. Now, the external snapping hip syndrome actually is coming from the outside here. So, and that can go ahead and strum under top of this, what we call the greater tubercle bone. Okay, and that could snap over. So somewhere along the line, there's a tendon either on the outside of the joint or on the inside of the joint. When you start moving that leg around, that ball is rolling inside there and is causing that to occur. How do you get rid of it? Like I said, there's 1,000 different things you can do. Most people think that it's coming from actually the iliopsoas. So you're going to see the lunge stretch that's shown all over the internet to focus on, okay, how do I get rid of the pain? Now, to do that correctly is the trick. A lot of times you can get your spine involved as you're actually moving forwards through the stretch out that hip. You're actually getting way too much stress on the lower part of your spine because that's what's doing all the movement and compensating for the tight hip muscle. So I always tell people to lie down, drop the leg off of the table, and then get the stretch in that way like it shows in the picture. Much safer for the spine stabilized against the surface and your leg is doing all the movement, so you actually get a nice localized stretch to the actual muscle that you're focusing on. Now, if you look at my old snapping hip syndrome video, I also talk about a tennis ball technique that you can use. You definitely want to ice. You want to treat this as a tendonitis. Okay, and I've gone over the different types of tendon issues, and if you have any questions, you can go ahead and DM me down below. There's peritendinitis, tendonitis, and tendinosis. So there's 3 different phases that you can have with a tendon issue. Now, that's the huge piece of this issue. People not talking about the internet. There's an internal and external, so you have to really know which one you're treating. You can't just go ahead and do the stretch and like, oh, that's great, I'm going to be cured. It didn't work for me. Why? That's because you were treating something that is, so he's treating an external snapping hip when it's actually an internal snapping hip, or vice versa. So you have to know which one's causing the problem to begin with. That way you can effectively treat the source and then make your symptoms go away. Now, if you have any questions about that, you can go ahead and DM me down below too, excuse me. And I'd always love to have you subscribe, leave a thumbs up, a like. If you have any questions, you can always ask Scully or me. We usually will get back to you pretty quickly, usually within, I'll give myself a day depending on how busy I am. But until next time, I always like to say with Scully, look up and keep smiling. See you next time, folks.